Hello, welcome to Dr. Boison's Reality Check. In our previous lecture on occupation, health, and safety, we discussed about hazard identification and hazard reporting. That was topic 5A. In this section, we'll be discussing health and safety policy. So what is health and safety policy? Health and safety policy is a documented, requirement that sets out the organization's commitment towards ensuring a safe and healthy working environment. And we say that health and safety policies are general guidelines and they give indications as to how to promote the highest degree of mental, physical, and social well-being of workers within the organization. And ensuring the highest level of health and safety requires the well-documented policy. And for that matter, these policies are made based on a comprehensive, thorough risk assessment. There are 14 thematic areas that we suggest that the health and safety policy of our organization should cover. And these thematic areas include the company's commitment to health and safety, the staff responsibility and involvement in health and safety. Training is a key factor when considering health and safety programs. You need to indicate how training will be rolled out, and also issues about smoke-free workplace should be indicated. Office safety, children in the workplace where nursing mothers are allowed to bring their wards to the organization during when it becomes necessary. There should be a policy on that as to how to handle these cases and all that. And then workplace violence, violent staff, how do the organization's health and safety policy deal with that? Procedures for infection control when there's an outbreak of any disease, how is the organization going to control that? Client and staff confidentiality and infectious disease, first aid, environmental sustainable workplace, how is the organization going to cope with that? And then fire emergency, how are emergency issues regarding fire going to be handled? And then general emergency guidelines, monitoring and evaluation and reporting requirements. So we're saying that for every health and safety policies, our policy, these 14 thematic areas should be considered. So we move to the first step. So the company should demonstrate some commitment in the health and safety document. And we're saying that the health and safety document should comply with all legislation and accepted codes relating to health and safety. Staff of the company should have an obligation, to ensure that they are thoroughly familiar with the content of the health and safety policy. Staff should carefully read and understand the policy. The company should ensure that all line managers undertake the responsibility for the health and safety in each program that they outline, or in each program's area. The second point is the staff responsibility and involvement. It should be clearly stated how staff employees should be involved in the work, in the health and safety policy. For instance, employees of the company should be obliged in the policy to take care of their own health and safety. There should be a statement like that. And the safety of themselves and the others. Staff must receive information, instructions, ongoing supervision when working with potential hazard. And all staff are also expected to do the following: practice safe working habits, report on safe working conditions on our equipment, keep their immediate work area in a safe condition, and all that. And also accord the health and safety of customers, visitors a higher priority. The third point is training. There should be comprehensive training in the health and safety policy. Such training and information may include a legislative overview relevant to the workplace, including employer responsibility, consultative processes, and also issue of resolution, hazard identification, risk assessment, risk control. All this holistic way of addressing identification to identify hazard, identification of risks, and how risks are controlled. There should be an ongoing training on that to help remind workers of their responsibility, and also the employers of what they are also able to do to safeguard the environment where the worker or where the employees work. The fourth one is smoke-free workplace. And here we are saying that there should be some sort of posters, placed put at vantage point that will remind workers areas that are smoke-free and areas that are not smoke-free. So for instance, we've indicated here that the following areas must be smoke-free. You see that this statement is bolded, or they are all in capital letters, indicating, stressing on the fact that this area is not, it must be what, smoke-free. People should not smoke in this area. And for instance, we say public areas, visitors' receptions, all worksite, all rooms which meetings are regularly conducted, and organizational vehicles, workers should not smoke in those areas. The policy should be clear on that. Smoking must be allowed in some areas. That should also be spelled out. Office safety should also be indicated, and that is very, very important. Issues regarding the use of items at the office that can cause some sort of harm to workers should be clearly stated. So safe work practices at the office may include guarding sharp edge of furniture to prevent personal injury, keeping floor free of items that might cause tripping, not overloading electrical outlet, reporting immediately any damage, electrical cords, broken switches, loose connections. These are office safety practices, work practices that workers will be encouraged in the health and safety policy to be doing. Children at the workplace, as we spoke about, how do we handle nursing mothers that bring their children to the workplace when it becomes necessary? Staff member must keep the children occupied and not to distract other staff members. And if children are not well, they should not be allowed, they should not be brought into the office so as to minimize infection in the workplace. And also workplace violence. Violent workers must be asked to leave the workplace immediately. The incident may require making a report to the police and all that. Any behavior which constitutes a crime must be subject to legal remedy or criminal or civil justice. So violent, how do we handle violent, workers so that they do not injure other workers in the organization? And then procedure for infection control should also be stated. For instance, we are in an era where we are facing a serious pandemic, okay? And then we are being told, we are being given strict, procedures how we should adhere, and we should adhere measures to mitigate that. And it's the same thing we are saying here. How do we control these things? And for instance, we are indicated here that before preparing beverages and after using nasal tissues and handkerchief, you have to wash your hand before and after, and also after using toiletry, the toilet, you have to wash your hands. After touching animals or the environment, you have to wash your hands. In the case of the COVID-19 pandemic, we have been asked to do social distancing and also wash our hands with running water, with soap, and then sanitize our hands, and also wear our nose masks and all that. These are measures put in place to prevent any spread of any infectious disease. And client and staff confidentiality and infectious disease. So if workers have diseases that are infectious, we should understand that they have the right to their own privacy. But the question is, how do we deal with that? And we're saying that it's important that all employees understand the meaning of confidential information regarding a client or another staff member's medical condition or information of personal nature. So there's no legal obligation for persons infected with contagious or infectious disease to inform the member at work or members at work. However, some staff may choose to inform team members, and their team members and then team managers should respect their confidentiality and not to inform others about this. And first aid issue is also critical when it comes to health and safety policy. And we're saying that all workers must be provided with practical instruction about the following: and first aid facilities in the workplace, the location of the first aid kit, the names and work location of the trained first aiders. People should be trained, some workers should be trained to be the frontliners for first aid when there is a minor accident or there are some occurring incidents or accidents that will require the first aid to address those issues. So that is, first aid should be also considered in the health and safety, and people should know where to get this first aid and vantage point, and those who have been trained to take care of this. And then we have the environmentally sustained workplace. This, we are talking about sustainability. How do we ensure that our actions or inactions or the kind of input we are using to produce whatever the organization is producing doesn't endanger the environment? That's all about environmentally sustained workplace. So we're saying that care should be taken that products used are, wherever possible, environmentally friendly. Chemical cleaners and insecticides should be avoided. So the company should, where as much as possible, purchase products with high recycle content. And then fire emergency issues should also be contained in the health and safety policy. We're saying that employees must all know the location of the fire extinguishers and then the fire blanket, and be familiar with the fire alarm system also. The first person to observe the fire should immediately sound the warning alarm by activating the nearest alarm pull station, report fire to the fire brigade. If possible, use available fire extinguishers to extinguish or contain the fire. If the person is a trained person, if fire is fueled by natural gas or LPG leak, the gas supply should be shut off prior to extinguishing the fire. Immediately evacuate area, should initiate firefighting attempts when they fail. So these are the issues that should be contained in the health and safety policy when it comes to fire emergency. Then general emergency guidelines are general emergency guidelines regarding general event that could raise any alarm in the organization. It could be anything other than the fire emergency, that workers are supposed to follow those guidelines. We're saying that if necessary, remove yourself and others from the area, immediately remove any contaminated clothing and wash any part of your body contaminated. Do not spread the contamination. If there's an outbreak of something, a disease or something in the organization, how do we go by that? And we're saying that we should also prevent entry to the areas to personnel, example, closed doors, post warnings, and cover spilled powders with suitable liquid to reduce the dust. If the what happened was probably some contagious gas or liquid that was spilled at a certain area in the workplace, how do we go by that? Okay, and then the last one is the monitoring and evaluation and reporting requirement. And this is all about how we try to feed the health and safety policy with current happenings, just to revise the document and make sure that it's up to date. So the policy should be reviewed each year, and at other times, if any significant new information or legislation or organizational change warrants a change in that document, and it might include the introduction of new systems or equipment or processes. So we need to look at these 14 thematic areas very carefully. We need to include them in our health and safety policy to ensure that the organization is able to work, provide a safe and a congenial atmosphere for the worker, and the worker is also able to work safely, and knowing very well that his health and safety has been taken care by the employer. Thank you for your time, and then Do subscribe to Dr. Boison's Reality Check, and don't forget to click on the notification bell so we can send you videos as and when we load. See you in the next recording.